I'm Margaret Flinter, Vice President and Clinical Director of one of the country's oldest and largest community health centers. Our health center provides a broad range of services, medicine, dentistry, and mental health care to over 50,000 patients a year from our offices in central and southeastern Connecticut. But we can't do it all, and we can't do it alone. Right up there with the lessons of our local experience has been the learning from the remarkable programs that are being pioneered in communities around this country. The story we have to tell is about collaboration, both local and national. And though it could be told in many ways, ours begins in an herb garden in the north end of Middletown, USA. And it will take us all over this land.
Oh, my land. Oh, my land. Oh, my land. Oh, some better thing. Oh, my land. Oh, my land. Oh, my land. Oh, some better miles in my land. Oh, my land. My land. Oh, my land.
Choice created a Sustainable Healthcare Access Council. And what I found was that even though while people were cynical in their words, they started to come to the meetings and there was a tremendous sense of power that started to be created by people just being able to talk about a hopeful future.
You gotta let them argue. It's an uncomfortable thing. When people argue, you tend to not want that to happen, especially in small communities because everybody knows each other. But the more they fight and bicker, there's a point where they get tired of that. They sit back and they say, all right, now what can we do?
Everybody was sort of scared of what somebody else was going to do to them. And so sometimes in the early meetings, what motivated people to attend in the conversation was they just wanted to make sure that nothing was going to be taken away from them. And so it was a process of getting them to move out of that sort of defensive posture that comes from years of dwindling resources and competition.
The county as a whole, everybody exceeds the norms in Michigan for end-stage renal disease, for diabetes, for ischemic heart disease. I mean, you name it, we've got it. We're a very unhealthy community. And then if you look at the African-American community, it even exceeds our county norms. So really, really bad stuff. And what we did was we put together several breakfast meetings. We identified leadership in the Black community to come together, sit down, and so we'd get up in front and we'd say, well, this is really bad, and this is really bad, and this is really bad. Well, after doing a series of these meetings, people were just plain pissed, for lack of a better term. They were angry. It's like, what do we do? We need to do something. John said, well, it's time to put them at the table, get them going. And he said, let's get Irie. Irie just retired. So
what we were able to put together with our vision was to get everybody to buy into the purpose, which was 100% access to a defined set of services that everybody should have a right to regardless of their ability to pay, that we would achieve over 5 to 7 years. So the notion was nobody would be uninsured in our region.
When the coalition first started, it was due to a crisis. Community clinics were about to close. There was no county hospital. And when the parties came together, particularly the hospitals, county, and Kaiser Permanente, and decided collectively to take action together, it benefited all of us. We ended up preparing a plan for a county organized health system. We got funding from the state to become a pilot in Solano County. That gave birth to a very successful partnership health plan.
Incredible results within the first year. Emergency room usage dropped by 50%. Inpatient days decreased, birth outcomes increased. It was like an event, an occasion, a success that just glued this group of folks together.
When I hear people discussing the healthcare system, it almost always means that there's a problem. There's a problem for the patients to access health care, problems for state workers who become overwhelmed with the paperwork and the greater need, a problem for the providers who have stretched themselves to the limit.
All I know is I've got a world of folks out here who need good access to quality health care and they're not getting it. So my job then becomes to figure out why can't they get it? And when I figure that out, to remove that barrier.
Then the coal company came with the world's largest shovel, and they tortured the timber and stripped all the land. Well, they dug for their coal till the land was forsaken. Then they wrote it all down as the progress of man. And Daddy, won't you take me back?
It's like coal.
This is called Coal Harbor. It's the name of this mountain.
A lot of disease that's associated
with the coal mines. Yeah, emphysema, black lung. I've been doing this type of work for around 8 years. I like it. I like the people.
When you go to the doctor on the 16th, speak to them about an annual exam. Has any doctor in the clinic done that to you?
I don't think so.
Don't think so?
I really see these lay health workers as being the future of health care. There's not enough nurses there, and it's not the total answer. It has to be that there's continuity, not just in the doctor's offices and the hospitals, but once the patient leaves those, that someone helps navigate them through the healthcare system. So we're actually able to take those numbers and give us an idea of the impact of this program, if it's actually making a difference, if it's actually reducing ER and hospitalizations, and it has.
When we did an analysis of this, trying to figure out what was the best way of improving this system, we discovered that 6 million, half, went for care for 129 people. And when we researched that a little bit more, and as a matter of fact, we went back and looked at the charts for all 129 of those folks and found conditions that were highly preventable. So it said clearly we needed to do something to create a better system in preventive care for that population.
With this calendar, we were able to get the attention of the African American community as a work that was sincere and really about the business of helping the community to make some changes. And on this calendar, we feature men and women. Women that are survivors of breast cancer, and believe it or not, we actually got men to model on this calendar that are survivors of prostate cancer.